Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health.
Michelle, with your personal story, I think you can really speak to the fact that when you go into the healthcare system, oftentimes you come out with more than what you wanted. And a lot of times I've heard that when your only tool is a hammer, everything starts to look like a nail.
Yeah.
So with your experience, you can really speak to going into the healthcare system and yeah, they can take out your uterus.
Right.
But is that really what you need?
Right. So mine was unnecessary. We know that. And then they removed everything because I was told that 20% of women will come back who, if I didn't have my ovaries removed, would come back and they with ovarian cancer. But no one said, FYI, you could still get ovarian cancer even though your ovaries have been removed. So there's this lack of information. So you're trusting of someone who, if you're going to a surgeon, what are they going to talk to you about? They're going to talk to you about surgery, because that's what that's what they specialize in, right? So you have to be very mindful of the situation that you're getting into, and then, is this really the right approach for you to take? And the great thing about what's happening today is that we don't have any choice anymore. We have to own it. It's ours to own. I think we've been a society where we've kind of sat back and, particularly women, I can't speak to men, but particularly women, we've acquiesced to the system. It's called white coat syndrome. We have it. We think we're going to be bitchy if we say something that we shouldn't, or if we question, and we get rushed through the system quickly, and we're complicated, right? Our systems are complicated, and yet nobody looks at the complexity of us as individuals. They treat us like we're the same. And I said to Dr. Kevin last night, I go, do we look the same? Because we were talking about this earlier. He said, thank God we don't. But there's a reason for that. So there's a movement. I call it a movement. There's a movement for you to start taking charge, right? And to start navigating things differently. I call out insurance companies online. Do you know why? Because I can't stand when they say, we don't cover this. That drives me crazy. I hear it every single day. It makes me sick to my stomach because there's some fine print that says we don't cover this. The average American, do they know what the 10 things are that should be in their insurance policy to make sure they have it in there? No, they don't. Because they make it so difficult for us. So we need to, and you talked about this earlier too, Cindy, and you, Kevin, as well. We need to simplify what you need, educate you about what's important and what you need to look for in your health care, and fire your darn doctor if he or she isn't doing the job. It's that simple. You are paying for this service. And I will say tell you one quick story. I had the surgeon, the internal medicine doctor, and I had the doctor that got me well. And I had a dinner party. And I invited them all to dinner. Now, I'll tell this story later, so don't tell anybody. But so I had a dinner. I had a beautiful dinner party, and so I took everybody into the living room, and they all sat down, they had their cocktails, and I said, so now I'm going to tell you what you did to me. And I said it in a nice way, but I told them, I said, you almost killed me. I was this close to death, taking my own life because of what you did, and then there was no treatment. And I don't want you to do this to another woman. Please, I beg of you, change the way you practice. And the surgeon started crying. And the doctor that saved my life was the one. So the three of them now work together. The surgeon no longer gives out medication for hormone replacement therapy because that's not what he does, right? That's what he did to me, which is what really screwed me up. And the doctor who knows this, now they cross patients. If she knows that someone absolutely has to have a hysterectomy, she sends them to him. If he knows that he's given them a hysterectomy, then they go to her. And then my internal medicine doctor is the one who said, I'm giving you permission to go advocate for yourself. That's the thing he said to me. Because I don't know how to fix what's wrong with you, but you're going to figure it out. And as tearful and as unhappy as I was about that, he actually gave me permission. So I went out and I bought 32 books on the subject and became an expert by default. Those were the days when you could buy books in the bookstore. But my point to that is that, you have to do your part in this. And it doesn't mean you have to be nasty or mean, or there's a way, just like you said, there's a way to say it. Because if they don't know, if doctors don't know, how are they going to know? If you just don't go again, will they ever know that they did something to you that was not good? That could change the way that they practice, as well as change the way that other women, that's why it's all important for us to all share. Because when you share stories about your health, other women learn. And that's how we're going to make changes in the system.
Wow, that's a very good story.
Yes, that's
And
pretty powerful.
the internist that said, I don't know what's going on with you,
Yeah.
and I encourage you to go investigate this. I applaud that, and I think that you may agree with me that that's pretty unique. That you don't hear that a lot from doctors. I don't know. I don't know could be one of the smartest things people could ever say.
Thank God, really,
Right.
thank God. But he knew me. See, he'd
Mhm.
known me for years. So
Which
when
is key.
Yeah, which was really key. Like, you can't be training doctors all the time and think that you're going to get so he really did know me, and he knew there was something wrong.
Mhm. So you may be able to hear those words, I don't know, when they don't actually use those words. When it just feels
So true.
like
So
they don't know.
spot on.
And that's something to listen to within yourself. The doctors are just human. They don't know everything about everything. And we know that. And probably they do too. But it's a very strong thing to say, I don't know.
Yeah.
I think. So that's a great segue into the next topic, which is, what is health? And I will start off with the statement that health is not something a doctor can write you on a prescription pad. Health is not something that you can take in a pill. So what is it? And how can we reframe how we view health, Dr. Kevin?
Oh, gee, you always start with me. You got hard things like this. Could I just back up a minute and just take, Michelle, something you said, and that is, any relationship, and whether it's with a husband and wife, kids in a family, whatever, anything takes time and energy. You have to put that into that relationship. And think about when you were in high school, you had these friends and you said, we'll be friends all of our lives. You probably think, where are they now? Well, because you didn't put any time and energy into that relationship to maintain it. And with doctors, I think it's the same thing. In order to be trusted, you have to put time and energy into that relationship. It takes time to feel comfortable being able to say, I hate my husband, or I hate, I'm just sexually, this stinks. But you're not going to say that the first time you go in to see somebody. So it may take time for both of you to feel comfortable to begin to broach those subjects and to trust them. So that's one thing I would say to you, develop that relationship if you can, and that's the one good thing, and work on one thing at a time. So to come back to your question about health, health is different for every person. When I started out as a young doc, and I've been doing this now 45 years, and I think to myself, well, how do I teach young people? Because I teach younger doctors, and one of the things I try and teach them is that work on what is important to the patient. Ask them, what do you really want to work on? What's important to you? What's the first thing? Because I may not have all the time to take care of the 6 or 7 things that that are that I can identify by doing these tests and everything. But what's important for you? Because it may be very different. And where before I was saying, well, you need to lose weight, you need to do this, you need to do, well, that's garbage. They're not going to do that. But how can I help you do what's most important to you? Then after we do that, then we can work on the next thing. Because everybody's health things are different. And so I think it's a matter for you to say, well, I'm really I want to get some more exercise. So how can I help you do this? And remember, when doctors go to medical school, they don't learn a lot. I think they learn a lot. I hate to say that, but we only learn very limited things about anatomy and physiology and medicine, but we don't learn like, how does the social system work? How can I use a dietitian in my office? Or how can I use an exercise physiologist? Or I need all this team to help me. So it's going to take a team. It's like a village taking care of your children. Well, it's the same thing here. And if your doctor doesn't have a team and doesn't use other people, time to go looking somewhere else.
The Federal Health Insurance Marketplace is now open. That means you're free to shop for the health plan that's right for you. UPMC Health Plan has some of the most affordable plans on the marketplace. And they all give you full in-network access to UPMC, plus other doctors and hospitals in your community. Visit upmchealthplan.com or call 1-855-297-UPMC to learn why so many people have chosen UPMC Health Plan. Enroll today.
Great.
And Michelle, you mentioned when we spoke before about this panel and these topics, about a group that you've worked with that utilized a lot of those other variables, water,
Yes.
meals,
Yes.
stress management. Can you
Yes.
tell us a little bit more about that?
Yes, there was, and to go off of something that you said, Dr. Kevin, we lie, as patients, we lie. We don't tell the truth. It's called full disclosure. And you have to be willing to fully disclose to the doctor in order to get a better outcome. And we don't always do that. So I'm calling you out on it, as I called myself on it, that you really have to be prepared when you go in to see a doctor, and you also have to have full disclosure. And if you're not comfortable enough to fully disclose everything, that's not the right doctor for you. You need to go find someone else. So just to add to that. So yes, there were 9 things. I met with a young PhD from Harvard, just a really zippy young gal who was looking at a gentleman who had late stage cancer, stage 4 pancreatic cancer, and he survived. And so she was thinking to herself, he survived. How did he survive? No one had ever looked at, so she started to investigate, and she found that no one had ever looked at what the survival rate was, why people survived late stage cancers. So she said, I'm going to go get a grant. She goes and gets a grant. The book's called Radical Remission, if you want to read it. I highly recommend it for anybody. But she talks about, so she interviews 1,000 patients in 10 countries. She gets a grant from, I think, the NCI or the NIH. And so she goes around the world. She interviews 1,000 patients, and they all have 9 commonalities, 9 common things. Now, overall, they had like 75 things that they were doing, but there were 9 common things. I'll try and remember them off the top of my head. So filtered water was one, which was interesting, right? Because we have bottled water, we have all this water, but filtered water. No sugar, no wheat, no dairy, no sweet. No sugar, no wheat, no dairy, no sweet. Thank you. They had spirituality. They believed in they had some type of faith. They advocated for themselves. Interesting. Their intuition, they've tapped into it. They had not tapped into it before, which is also interesting. They took a prebiotic. They took a probiotic. They took something that actually cleansed their system. So, if they had any iron or any toxins in their body. Those were, and there's more, right? There's a few more, but those are the top ones that just come off the top of my head. Again, that gives you some really great information. So you may not have ever heard about radical remission unless I told you about it, and I suggest you tell others about it, because I think it's just a great example of how we're switching it up, right? Here's a woman who goes, so I wonder why they all survived. And so that's how you have to look at your own health, right? So what can I do to make my situation better? Sleep, exercise, diet. You really control your own outcome. You really do. It's your body. You own it, and you get to control it. Now, things that are out of your control that you're going to need help with, but certainly these are key things that you can read about whether it's online, whether it's, there's a lot of places where there's great information, but make sure it's great information. We like science-based and research-based information. We all do at this table. But I think it's really important that, those are just basic common things that you can do that can really make a change in your life.
I love that, and it's something that I think about. If you need to rationalize getting a weekly massage or even more frequent massage, if you're having problems with stress or not sleeping well or anything like that, it's something that you need. That these are symptoms of you telling you there's something that needs to change. You need to bring in some more self-care. So maybe it's not massage for you. Maybe a facial is more relaxing, or a support group, or switching from regular coffee to decaffeinated coffee, but just things like that where you're really listening to yourself and taking care of yourself. So we decided that one of those 9 steps was important enough to make its own topic, which is that concept of intuition. Your top tips for people in getting better health with more skillful use of the current healthcare system. Dr. Kevin, what would you say is your number one?
And I think the thing you can do is really just be informed consumers. I know it's really hard, and people tell you that all the time, but if you can go in and do some research, you get a prescription from your doc doesn't necessarily know that prescription interacts with a supplement that you're taking or a vitamin you're taking. And so I would say to you, talk to your pharmacist, go do some research online on this kind of thing, and look for, as you talk about, maybe a little bit of the integrative approach. Are there other things out there that we know, like say for instance with a cold, we know if you take echinacea and zinc early on before with a viral kind of thing, you can actually, cut down the length of time that you are sick and that kind of thing. And you don't need to take an antibiotic, especially if it's a viral illness, that kind of thing. So do that kind of research and you can be better informed. So I think that's the key.
Michelle?
So I have a whole list. No surprise, right? So there's a website called pharmaquotes.com. And if you're having a problem with prescription drugs, for example, and it's costing you too much money and you can't get the real drug that you need, I would suggest you go there and take a look, because they have all the drugs are discounted and there's a ton of them. And so that's always a great resource for everybody who has to take a medication, right? If you can do the holistic approach, it's always the best way. And I've got we have lots of holistic things on our site for different ailments. Advocate on behalf of yourself. If something's wrong with you, there's something wrong with you. I will say this over and over again, because you'll go into the doctor and they'll say, oh, you're fine, you have a lot of stress, but you're fine, but you're not fine. You leave there and you're still not well, so you need to keep at it until you get to the bottom of it. Don't give up. If I would have given up, I would not be here today. I would not have started this company. I would not be on this amazing journey helping women. So don't give up, because there is a solution to everyone's health issue. There always is.
Thank you so much for joining me this week for this episode of Hot for Your Health. You are a powerful force in your own health, and I'm excited that you took the time this Thursday to learn more from our nation's authorities in health. I hope that you subscribe so that you don't miss one single episode. Join us next week for Hot for Your Health, and for more information, find it at womenshealthconversations.com.